Lady now recognizes the gentleman from Georgia, Dr. Gingrey, for 5 minutes for questions.
Mr. Chairman, thank you very much. This is really for all of the panelists. Some have suggested that the mobile apps may be a game changer for healthcare delivery and consumer engagement. Do you agree with that statement, or do you believe they have already changed? Why don't we start at the end?
It would be sad if where we are is where we're going. And so I have to believe that we're looking at the front end, on the cusp of a transformation in healthcare where engaged consumers work with a coordinated and integrated healthcare system, and so we can realize the important benefits of having ambient healthcare as opposed to having the model of healthcare delivery that we've been living with since my grandparents were.
Sure, thank you.
I 100% agree with that. Absolutely agree with that.
Support the comments of my colleagues.
And I would agree.
All right. Excuse me, I didn't realize my phone was live. I apologize for that, panelists, witnesses. Dr. Smith, who makes mobile apps? Is it sophisticated big developers, or are we talking about the little developer working out of the garage, these entrepreneur types, or is it both engaged in this activity?
So over the last 3 years, I've probably met with 1,000 companies that are interested in this space, all small, all largely unaware or incompletely aware of the regulatory framework that they're kind of naively entering, and find a bit of frustration as they realize that there's this other burden that they're not yet aware of. It's not enough to solve the problem. One must then engage a system with its own set of rules. And so it's often a fresh graduate out of a graduate school or even an undergrad who identified a problem in his family, the healthcare that they see, and are trying to figure out a way to solve it.
The next question from Mr. Bialik. Today there are roughly 97,000. Can't believe that, but this is a statistic that I have. Today there are roughly 97,000 medical apps in the Apple App Store. 97,000. These apps have generated more than 3 million free downloads. If the FDA regulates medical apps as medical devices, and these products have to go through regulatory review at the agency, and then they become subject to the 2.3% medical device tax, how likely do you believe it is that these apps will remain free to the public?
I would just say that any additional cost added to the development process is going to change the marketing approach for it. I mean, this is a very capitalist market that we've created in healthcare apps. I would say that if you're going to increase the startup cost, if you're going to recoup that cost within a reasonable amount of time, you're likely going to have to change how money is coming in. And so that's either going to be to stop offering them for free or require that end users pay for additional functionality within the app itself.
Well, sure, exactly. And I'll stay with you, Mr. Bialik. The death toll for chronic conditions is a staggering number. More than 10,000 people die every day because of chronic conditions. Not only is the human toll large, but of course the economics behind it are driving up health care costs. They're harming our household and national finances. And as these costs for health care go up, more money is diverted from other programs. It's diverted from job creation, indeed from consumers' pockets. How can health information technologies, such as medical apps or electronic health records, if not classified by the FDA as medical devices, how can they address these problems, and how do we accelerate their use?
So to address let's look at a really high cost problem specifically to get to your question, which would be something like dually eligible beneficiaries between Medicare and Medicaid programs. Even if you were to target a specific issue like using these mobile apps to provide very high touch care, So we're not talking about managed care, but rather we're talking about a direct way for the patient to be reminded for something like, imagine taking their medication. Some of these issues that could avoid the number of costly returns to the hospital. That's a very direct and tangible way that people can interact with their health care. That's what should be accelerated.
Well, and that's the point I wanted to make to the witnesses and to my colleagues on the subcommittee. These devices, these medical apps, they don't draw blood. They don't take a biopsy. They're not invasive. They're just giving information to people in a timely fashion, and if permitted, to members of their family to know what's going on with mom or dad that's 5,000 miles away and maybe very elderly, or maybe even in a nursing home. I mean, this is a hugely important subject, and I commend the chairman for assembling this panel of witnesses and discussing this subject. So, Mr. Chairman, I thank you for letting me go over a little bit, but I appreciate it, and I yield back.
Chair thanks the gentleman, and now recognize the gentleman from Florida, Mr. Bilirakis, 5 minutes for questions.
Thank you, Mr. Chairman. I appreciate it very much. Thank you,